So now we need to talk about how to evaluate a back patient. Hopefully we all agree that back problems is significant in the worldwide. And it's a major reason that people miss work. It's a major cause of disability. So physical therapists, of course, need to be involved. In my early career, we did what was called HUM, H-U-M, heat, ultrasound, and massage. Every back patient got heat, ultrasound, and massage. Well, how specific was that? It wasn't. Now what everybody's doing is core strengthening. Does that really treat the pathology? No. And we'll talk about that. It does something else, but it doesn't treat the pathology. So, we need to be more specific. We need to be better evaluators. We need to be the more anything that's wrong with the body. The more specific you can be with evaluation, the more specific you can be with treatment, the better chance you have to help somebody. And let's try to treat the pathology if we can. So you start with a subjective evaluation. I ask the patient, what is your complaint? Where do you hurt? Well, they might hurt in their hip and think it's their back. They may just hurt in their low back. It may go all the way in the buttocks. It may go all the way to the knee. It may go all the way to the foot. Well, did something happen recently? Did they have an accident? Were they in an automobile accident? Did they fall off of a ladder? Or has it just come on slowly? They can't relate it to any particular event. So then I asked, well, what's your best sleeping position? This is a big clue, a huge, I can almost diagnose it from that sometimes. If people say, I can't sleep on my back, I cannot lay flat on my back. I have to sleep on my side, sort of in the fetal position, or like they're in a chair but on their side. Huge clue. This is the other thing I ask. People they're going to tell me what's wrong. And sometimes with these two questions. What aggravates your back? I can't bend over. I can't lift. I can't stand for a long period of time. What relieves your back? Sit down. Or lie down. Or heat. Or all of these, if in your mind you're imagining the biomechanics of it, you're getting an idea of how to treat the person. People try to get out of pain. So what relieves the back pain gives you a big clue as to treatment, and what aggravates gives you a big clue as to what the pathology is. So does it occur in certain positions or with certain activities? Bending, lifting? You ask all of those questions. This is a big clue. Are you worse sitting or standing? You notice I'm sitting? I have one of these back conditions. I could not stand and give all of these lectures, these presentations. So that you should be able to diagnose me right now. Is the pain getting worse or better or staying about the same? You need to kind of get a sense of the course of it. It could be getting worse. So they may have been to other clinics and nothing's helped. Or I was given all these core strengthening exercises and I got worse. All of that gives you big clues. Also the prior work. I live near a military base. Well, all the fitness stuff, believe me, I know. I was still taking the Army fitness test in my 50s. If they have been an athlete or they have been in the military or they have a job that they're on their feet all day, all of those things will give you clues as to what is going on or what caused the back to be as bad as it is. Current work, are they standing at a cash register all day? Ask those questions and see if you can begin to start to figure out some things. Workers' comp. That's a whole nother story. I will admit, I have had some patients that no matter what I did, they didn't seem to get a whole lot better, but as soon as the workers' comp case was settled and they got their money, whoop, they were gone. So I can't say that that does not happen. It does, and you need to know if you're dealing with that. So that needs to be a question that you ask. Any prior treatment? What did they do? I ask everybody, have you seen a chiropractor? Have you been to another physical therapy clinic? Have you seen a physician? And of course, almost all of them have. Are you with pain management? That's a whole nother discussion. In my early career, pain management was where people were sent if other things didn't work or if they had some terminal illness and you couldn't cure it. Now they go to pain management right off the bat. So they may not have even had physical therapy and they're at pain management. And this is another interesting thing. I used to get a lot of referrals from local pain management clinics. And if I got them totally out of pain, they didn't need to go to pain management anymore, so they lost a patient. So guess what? Pain management quit sending me referrals. It shouldn't be like that, but it may be. And I wanted to talk about a little bit about when I asked people that have been to other PT clinics. I said, well, what did they do? They can tell me what they did. But what I asked before that is I say, what did the physical therapist tell you that they thought was wrong with your back? And I'm not sure I have ever had a patient that has been to another PT clinic that could tell me, oh, the physical therapist thought I had this. I don't think I've had one. So should we as therapists be telling patients what we think is wrong and how the treatment that we are putting them in should help them and why it should help, how it could possibly help? I don't think we're thorough with that, and maybe because we don't know. We don't know what to tell them. Hopefully, at least when I go through all of this stuff, and it's lengthy and it's involved, but it is so rewarding to get a patient who is 93 years old and you treat them for 6 weeks and they walk in with a pain of 9 or 10 out of 10 and they leave with 0. It just doesn't get much better than that in physical therapy. So I'm not saying I can cure everybody. I'm not saying I can get everybody to 0, but I'm saying I can get a lot of people a lot better. And I think I'm kind of zeroing in on which patients benefit from what I do. Prior surgery, oh my gosh. Now that mucks things up. The anatomy's changed, oh gosh. And some people have one surgery and they're not better, so they have another one and another one and another one. Some people 4 and 5 back surgeries. It just gets more and more complicated and less likely to be able to help. I will tell you that I've had a few patients that maybe have had a fusion at one level, and then over time, the level above or below, if there is one below starts to bother them. I treat it as if that's the only problem. And I've been successful at that. But prior surgery, in general, makes PT very difficult and a lot more complicated. And then there are tests that people can have, x-rays. You can see bone with x-ray, but you really can't tell about disc. And in my opinion, what I see in my clinic are mostly disc problems. So an MRI is by far better, and I hope you therapists out there are learning to read MRIs, and if not, get on it. It makes it so much more rewarding to be able to diagnose from a clinical exam, and then you look at the MRI, and it's exactly what you thought from your clinical exam. You get pretty proud of yourself. You're at Maslow's hierarchy. When you can do that. CT scans also may be done, and some people can't have MRIs because of metal in their body or for whatever reasons. I ask about medication. Are you on any medication for your back? If they go to an urgent care, they're going to put them on muscle relax or something to relieve pain. Sometimes they're on a Medrol pack for inflammation. And sometimes they're not on anything for their back. And then I ask about any home treatment that they've been doing, heat, cold, some things like Biofreeze, some ointment, and of course Jack Daniels. We need to know what's going on and how they're trying to treat themselves. I also ask about medical problems because there are other things that can be wrong in the body that is not a spine problem, but it presents itself as pain in the area. So I want to know if some other problem is going on in their body in this area. If they have bowel issues, bladder issues, kidney, and of course male or female organs, any of that can seem to be a spinal problem. You can kind of get a gauge if somebody's had a recent illness, if they have a significant weight loss or any history of malignancy, because you can get metastases into the spine from other areas of malignancy. So these are ideas of things. I do this with every single back patient, and this is the first thing I do, is to do the subjective. And sometimes I already have a pretty good idea of what's going on, so the objective will just confirm what I'm suspecting from the subjective. So do a very thorough, I have this in a form, so I don't have to handwrite all of these things. I just fill in the blanks. But all of these are giving me very good clues about what's going on with this patient's back. Thank you. This is Gloria Sanders again. I want to thank you for listening to my videos, and I invite your comments. All medicine should be a discussion, and that's how we get better at what we do. We need to be able to explain why we do what we do. There's no one way to do things. So I want to hear from you. I don't know what you're being taught in PT school now. So are your professors master clinicians? Maybe, maybe not. Have they seen patients in the last 15 years? Maybe, maybe not. So I want you to tell me what you're seeing, your new graduates. Tell me what you're seeing in your clinics. Tell me what you like about this. If you disagree with something, I want to hear it. And I'll get back with you. I want a lot of comments, and if I get them, I'll do a video of just responding to comments, because I think medicine should be collaborative, and I think we need to share experiences, and I'm trying to do that with my experience, but I want to hear back from you. So subscribe, like, don't like, let me hear from you.